Hello everyone, you're watching Netflix and today we are going to learn about Iceberg Phenomenon of Disease. This lecture is dedicated to all my students of dreams. So let's start. So let's get a little pictorial at first. I'll show you an image and you tell me the first thing that comes to your mind after seeing this image. Yes? So now that you have seen the image, what does it remind you of? Titanic, yes. And I think most of you have guessed it right. So, this image or this painting is about the sinking of the unsinkable ship called Titanic. And why did it sink? Because it hit an iceberg. And today we are going to learn about that. Not the movie, but what is an iceberg phenomenon. So, apart from the fact that an iceberg had hit the great big ship called Titanic, what else do we know about iceberg? The word iceberg is derived from Dutch word ijsberg, which means mountain of ice. An iceberg is a large piece of fresh water which is freely floating in the open salty waters of the seas and the oceans. Now, the most interesting fact about the iceberg is that about 80 to 90% of its volume is submerged underwater. Now, this gives rise to an interesting expression called tip of the iceberg, which means that what we see actually is a small part of a big, large thing. And most interesting and happening things is actually happening beneath the level of what we can see. So now that we know what is an iceberg and the composition of the iceberg, let us proceed to learn about iceberg phenomenon of disease. The iceberg concept of disease or the iceberg phenomenon is closely related to the spectrum of diseases or the natural history of diseases. In this concept, the diseases existing in a community is compared with an iceberg. Now students, as you have seen in the previous slides, the iceberg has two parts. So the floating part and which is also called the tip of the iceberg, and the submerged part which remains hidden from the public glare. So much so that we sometimes think that this part does not exist. So we can compare this floating part with the clinical cases who come with symptoms or who seeks medical attention, and this part or this portion is very small, but yet the physician is concerned with this part. As he is seeing this part, he is concerned with this part, and as he is seeing this part, he can apply a diagnostic test to confirm the diagnosis of these cases. So students, now let's move to the second part of the iceberg, that is the submerged part or the hidden part. But before we reach to that part, we have to cross a water line or a water level. And in the community, this water line represents the demarcation between the apparent, that is the symptomatic cases, and the inapparent or the asymptomatic, pre-symptomatic, latent cases existing in a community. Now, the water around the submerged portion of the iceberg represents the healthy population. This healthy population may or may not have any risk factor of the disease. So, I hope it's clear. Let's get to the submerged portion or the major chunk of the iceberg which remains hidden because it is beneath the level of water. Now, let's take a situation where a sailor is not aware about the submerged portion of iceberg, and that is why if a ship unfortunately hits the iceberg, he won't be able to mitigate the losses or the impact of the submerged portion. This will increase the damages to his ship and the people traveling in a ship. So it is important that every sailor is aware about the submerged portion of iceberg. Similarly, in a community, it is important that we know about the submerged portion of a disease. Now, what does the submerged portion of a disease constitute of? It constitutes of the inapparent cases. The inapparent cases may be latent, asymptomatic, presymptomatic, or undiagnosed cases, or even they may be carriers. Now, this portion will constitute of the major reservoir of any disease, and that is why it is important for the community to know it very well. However, since this population does not seek medical help, or more often they are not symptomatic or mildly symptomatic, they often remain unseen by the population as well as the clinician and the government. So what happens is, proper fund is not allocated to address this population. The national health schemes and national health programs often overlook them, so they become more vulnerable. So this is the place where the role of the epidemiologist will come in again. The epidemiologist is concerned with this part of the iceberg, and he will study the natural history of the disease and the spectrum of the disease, and he'll try to bring out the hidden cases to the notice of all. The hidden cases are searched by screening. Screening is done by applying a test that is easy to do, that is inexpensive, that is preferably non-invasive, and which does not require any trained professional to be done. So it is important that these cases are brought to the public. This makes screening a very important topic in public health and community medicine, and that is why I'll be uploading a lecture on this very soon. Now you have to tell me one thing: what is the difference between asymptomatic cases and pre-symptomatic cases? Is there any difference? And give me a good example of a carrier. Now let me explain the submerged portion with the help of a recent example, which is of novel coronavirus disease. COVID-19 is a new disease, and that is why the submerged portion of the disease was not known, which made the different countries undergo huge losses because they were not prepared to face it. Even the most developed countries at times were so frustrated that they were almost near to defeat. The financial losses along with health crisis that the countries have been facing is so huge that it will take years to reach the pre-pandemic phase again. The mental health of the people were affected. There were many suicide cases, there were many depression cases, and people dying of comorbidities was very high. There were movement restrictions, making the fundamental rights of the people come in question. Also, people were getting unemployed, making the financial burden higher. So these all were more because the submerged portion of the iceberg of the disease was not known. So you can understand how important it is to know the natural history of the disease, the full spectrum of the disease, and the whole of the iceberg of the disease. Now, if the submerged portion is of an infectious disease, then what happens is the asymptomatic cases will be transmitting the infectious disease to the unsuspecting healthy population surrounding them. And if it is of a non-communicable disease, then it will lead to poor quality of life, increased disease burden, leading to increased financial burden to the nation, to the family, and to the individual. So in this slide, we give some examples of iceberg diseases. Now, iceberg diseases are diseases which exhibit the iceberg phenomena or which follows the iceberg phenomena. They may be infectious diseases or communicable diseases, or non-infectious diseases or non-communicable diseases. Now, in communicable diseases, tuberculosis, hepatitis, typhoid, COVID-19 more recently are some examples. In non-communicable diseases, hypertension, malnutrition, cardiovascular diseases, diabetes mellitus, mental health problems like depression or schizophrenia or Alzheimer's. These are some of the examples. Now, if I may say so, that most of the diseases will follow the iceberg phenomenon. So, from exam point of view, it's more fruitful if you know the diseases that don't follow the iceberg phenomenon, and that is a very important question in NEET PG or various entrance examinations or MCQs. So, as I was saying, diseases that don't show iceberg phenomena are very few and hence easy to remember. You can use a mnemonic of your own, or the mnemonic I use called meter. So, measles, tetanus, rubella, and rabies are 4 diseases that do not follow the iceberg phenomena and is often asked in various MCQs. So, you have to remember these 4 diseases. Whenever a person suffers from any of these 4 diseases, he will show symptoms and he will come to the notice of the family or the community, and most likely will even seek medical help. So, these diseases cannot remain hidden from the public eye. So, dear students, with this we are about to end this lecture. I would like to tell you, if I may say so, that I have tried to be exhaustive in this lecture, and I don't think that you need to refer to any other resources for learning iceberg phenomenon if you have gone through this lecture properly. However, if you want to learn about related concepts of screening or spectrum of disease or natural history of disease, you may use these references that I have listed and I have used while making this lecture. Also, this time to help you for exams, I have used a superscripted Q in some of the sentences. These sentences are topics that have been asked in various university exams or NEET PG or other entrance exams time and again. So you have to be very thorough with these topics. So students, I hope you had a good time. Keep coming to watch more videos. Thank you and have a good day.